is Gina Gray and I'm gonna do the insertion skill video. For this video, we want to check the healthcare provider's order. In his order, we gonna have to put NG tube, and we have gathered our supply. I have a gastric sump tube, 16 French, 48 inches long. I have a 60 cc syringe. I have a pen light. I have gloves. I have paper tape, jelly lubricant, safety pin, absorbent pad, towel, specimen container, pH strip, emesis basin. I said pH strip, but I don't really have that on hand, but it's a must for this procedure. Okay, I'm gonna go ahead and go enter the patient's room. I'm gonna hand sanitize. I'm gonna introduce myself. Hi, Mr. Smith. My name is Gina Gray, and I'll be the nurse doing the NG insertion for you. Can I have your name and date of birth? See your wristband. Thank you so much. I'm gonna go and provide some privacy. I'm gonna hand sanitize. I'm gonna put on my gloves, and I'm gonna explain the procedure to the patient. So, Mr. Smith, this procedure is ordered by your doctor. So we're gonna put the NG tube. It's a tube that we insert through your nose, and then it goes down towards the stomach area. And what it's gonna do is, what we wanna do for you is we wanna suction those gastric contents out so that your stomach remains empty, and it will relieve you from some pressure and discomfort, and it will make you not vomit as much. Okay, it will make you feel better. Do you have any questions? No. Okay, so for this procedure, like I said, because we're going into your nose, we want to check the integrity of your nose, and once we make sure that the integrity is fine, we insert the tube, and we want you to do two movements for this insertion. One is when you hyperextend your neck back, okay, once in the beginning of the insertion, and then once we get to your throat, you may feel a little gag, and that's pretty normal. And that's when we change your position. You're gonna switch your position, your head position forward. You're gonna move your chin to your chest, like that. And we're gonna keep pausing. We're gonna have you drink some water. You're gonna pause, drink water, breathe, and then when I say swallow, you swallow, and then I'm gonna insert it 5 to centimeter more, so that when I'm inserting it, we don't go to the airway, or you close the airway when you swallow, so we don't go to your lungs, and we go to the stomach part of the body. Okay, do you have any questions? No? All right, I'm gonna raise your bed up. I'm gonna put you in a high Fowler's position. Okay, and I'm gonna go ahead and check your nostrils. Yeah, just hyperextend your neck back, put your head back. Yeah, all right, thank you. No abrasion, no deformities observed. Okay, it looks pretty good to insert the tube. Okay, we're gonna have you cover one of the nostrils, and then you breathe just through that one nose. Good. Try the other side. Cover the other and breathe through this side. Okay, good. Okay, from the assessment, it looks like we're gonna better airflow on your right side, so that's what we're gonna be using. I'm just gonna put my tube into basin with warm water, and then have you prepare. That procedure will make the tube a little more flexible and a little more pliable for me to insert it in your body, your nose. Okay, then we're gonna go ahead and measure how much we're gonna insert. We're gonna start from the tip of the nose, the earlobe, and the earlobe to the end of the xiphoid process. Okay, for you, it's around the 50 centimeter. There's a mark here, but I'm gonna go ahead and put another mark of tape for the 50 centimeter mark. So I put a mark so I know where to stop. I'm gonna go ahead and put this absorbent pad over your chest. So if you feel any discomfort during this procedure, just have you raise one of your arms to let me know. Okay, I'm gonna go ahead and start with the procedure. I'm gonna lubricate it. Okay, so your first move is you're gonna hyperextend your neck. Okay, so you look back. Thank you. I'm just gonna follow it and along the floor of the nostril, and then we're gonna go towards the ear. And if you feel any resistance, doing this first part, what you want to do is withdraw the tube, and then we're gonna re-lubricate it and insert it to the other nostril, because we don't that side is not working if you meet any resistance. Okay, we're just gonna go slowly. Okay, feels like we're at the throat. You're gagging a little. This is where we want to change position. Okay, change position. I'm gonna give you water and pause. I'm gonna take a breath. Then you're gonna swallow, and when I swallow, I'm gonna insert about 5 to 10 centimeter. Okay, swallow. You're gonna with your head, chin to the chest, right? Okay, swallow. Your head, chest to the chin. Just continue. Okay, just one more for you. Swallow. Perfect, you did a great job. Now we're gonna go ahead and check the gastric content. Let's see, aspirate about 10. Put it in the specimen cup. I'm gonna go ahead and check with the pH. Okay, your pH is less than 5.5, which means that we are in the gastric content. We are in the gastric area, which is the correct placement of the tube. Now, if I cannot aspirate, or the pH is more than 5.5, that means that we are not in the gastric area, or probably suspect that we are in the respiratory area, and we want to remove the whole tube for this patient and redo it again. Okay, so now that we have confirmed with the pH, what I want to do is secure the tube to the bridge of the nose, and then we're gonna secure the tube with a safety pin to the patient's gown, so that it's more secure there. And what we're gonna do is I'm gonna lower your bed back down. We're gonna call for the x-ray to do a second confirmation that we are in the correct placement. And then once the confirmation is there, once the confirmation from the x-ray confirm the placement is correct, we're gonna connect this to their suction apparatus, and we're gonna we're gonna make sure that the patency of the lines are indicated, and by making sure that things are not clamped, and that we're doing proper irrigation per facilities policy. And we also want to document and put down the characteristics of your drainage, like the color, the volume, right, and the consistency of what we are draining. Okay, now that you are set, what I want to do is clean up our supply. Remove my gloves. Do hand sanitation. And then I'm gonna be documenting the procedure that I did, the patient, the data assessment, the patient assessment, and the patient, if the patient tolerated the procedure. I make sure the patient is feeling comfort and safe. Feel okay, Mr. Smith? Okay. Yes. Okay, your call light is here. If you need anything, just let us know. Press the call light button. Thank you so much.